I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, Raw and Unfiltered. And if you've been following me, hopefully you've been getting the insights that you need to actually navigate your own health journey. I know it's rather complicated at times, and the reason being is that you don't necessarily have all the information, and then the information on the internet can be rather confusing. And even with all my training and my, what I like to say, my own insights, I'm still getting very confused many, many times. Reason being is that technology has advanced so much, and some specialties are so incredibly advanced, like my two guests are experiencing themselves in their professions, which I'm very excited to be sharing with you today. It gets confusing. And so rather than just selling a product or a service or just kind of lecturing you today, because I don't know who you are personally, but I do know that the process of making decisions is generally the same for everyone. And so that's what we get to do on this podcast. So we do that through role playing, where one person will present with a particular problem and the other one will act as a guide. Now, we only have about 6 or 8 minutes, so oftentimes we will get some amazing resolutions, but not always. But my hope is that you get to witness yourself in this particular role play because it's relevant to the kinds of problems and challenges that you're experiencing yourself. And through the role play, getting the insights and then the action steps that you can then take in order to optimize your health, because that is all what it's all about. And so before we get started, I'd like each of my guests, amazing guests, by the way, to introduce themselves just briefly. Then we'll go into the role play for about 6 or 8 minutes. And then after that, for about 10 or 15 minutes, we'll just unpack everything so you will get the insights and the action steps that you can take. So Curtis, please introduce yourself, and then we'll go with Evan, and then we'll jump into the role play.
Thanks for having me again, by the way. My name is Dr. Curtis Fedorchuk. I practice just north of Atlanta, Georgia. I've been in practice almost 22 years, and my practice focus is on structural rehabilitation. What I mean by that is, if you're out of alignment, we actually put you back in. We have myself and Dr. Katz, you're going to learn who he is. We've published research together, and it has always been our goal since we've known each other is to always advance the profession. And as Dr. Doug, who's in my office too, we say we advocate for our patients through research, as in showing what works, showing what needs to be improved on, showing what doesn't work, showing what's opinion versus fact. So, and we have a busy practice, and that's it.
And Dr. Curtis is as humble as always, and he's been on the show before. And my dear friend, Dr. Haas, really edified him in an exceptional way. He is a pioneer in this field, done tons of research, and is really leading the way on this structural rehabilitation. And what that really means, by the way, for those out there, when you think about your bodies, most people think of vitamins, maybe they think about medications, maybe think about nutrition, right? But the structural aspect of your body is so critically important that most people have completely ignored it. And so pioneering that path forward, and what both these gentlemen are doing, is so important. And I'm really honored to have you on the show. So thank you for that, Curtis.
Thank you.
Evan, a brief intro, and then we'll get into the role play.
Curtis also left down he's flying helicopters now too. He's becoming a helicopter pilot, which is awesome. Impressive. It is. So, hey, thanks so much for having me on. My name's Dr. Evan Katz. I practice in Boulder, Colorado with my wife, Shauna. I'm practicing since 2000, originally from the East Coast. During that time, we've treated thousands of patients with loss of cervical curves, abnormal spinal mechanics, cervical instability, as well as upper cervical instability. We published multiple papers showing why some of these pathologies are a problem. We published one of the largest cervical biomechanical papers comparing injured and non-injured, looking at 37 parameters to see what the difference between asymptomatic individuals have relative to people that are not asymptomatic. And then we just published the first paper ever actually fixing and stabilizing upper cervical instability using conservative measures, meaning up to this point, there was really just surgery that's been shown to fix it. We showed that there is a method that we could do. So, I'm just grateful that I've met Curtis along the way, and we've worked together, and other great providers that I know and work with, that we have the opportunity to help a lot of patients that have been suffering and have gone to a lot of places. And I never get tired practicing hearing patients come in that say, how come no one else has told me this after they've seen 100 providers? And that
Yeah.
makes us happy. It makes us sad, but makes us happy that we now know, and then we can get them on trying to get back to a better quality of life.
Yeah, and again, you're also a leader in this field, and what I appreciate what you both are, you guys are not surgeons, so that means you can't operate. And me being a surgeon, I'm also that guy that likes to not operate because the non-surgical options, when they're available, in fact, are oftentimes superior. And I would like to think that this is more of a precision type of medicine that you guys perform at the highest level. And if we can avoid surgery for so many reasons, which I'll not go into today, but I know you guys appreciate, it's always a better outcome. And certainly the advances that you're making is going to help, it will help many, many people. All right, so I know Curtis is presenting with a problem, so take it away for about 6 minutes.
All right, here we go. Hi, Dr. Katz. Just to let you know, I was in a vehicle accident, and my attorney, I did get an attorney, he said I should have been better in a couple weeks. It was about 60 miles an hour, and but I've been going to this chiropractor for a year, and he just keeps saying I'm out. And I still have dizziness, pain in my arms, headaches. And I was told I should see you because you do some CBP, XDMX stuff. So how can you help me? And is my attorney right?
Well, one, I wouldn't really listen to an attorney when it comes to healthcare. So let's start
Right.
with what you know, right? So you've been hurting for a year,
Yeah.
and someone is telling you that you should be better by now. Have
Yeah, they said a few
explained?
weeks, like soft tissue.
Okay, well, we hear that a lot. That's usually an insurance term because outside of a broken bone, everything is soft tissue. So when you're telling me a soft tissue, is it a brain injury? Did you damage a disc? Did you damage a ligament? Did your testicle get crushed? They're all soft tissues. So let's talk about what soft tissue you actually had. Has your provider, which I hope they did, explain to you what tissue got damaged in this crash?
When he grabs my neck, he says it's in the upper part.
So have you had any images?
I had a side X-ray and a front to back X-ray, and that's it.
So have they gone over these x-rays with you or explained to you if there's abnormality in terms of what the shape of your neck looks like or the stability?
Not really, just said, so I heard sprain, strain a lot. I
Okay.
heard out. I heard should have been better by now. Obviously, I'm not. And now they even like the attorney thinks I'm like lying almost. I looked up the term malingering. And I'm
Malingering.
like, but I'm
Okay.
hurt so bad I can't even function. I used to be super active, and now I can't do anything. I get, again, if I do any exertion, I get dizziness and headaches just from mild stuff that I used to be able to do.
Well, I mean, one, I just want to explain a couple of things to you so you don't feel crazy. When people tell you that you should be better by now in a couple of weeks after a crash, there's really no truth to that. And in fact, all the large studies they've done, and in fact, in the Journal of Injury, I think in 2015, they looked at 30,000 people. And of those people that are involved in crashes, they show that people who are involved in crashes, even 2 years after, have a significantly decreased quality of life. So there's no evidence that you should get better depending on your injury. So what we want to do is gather the x-rays you have, look at some other imaging, and determine the shape and stability of your neck. Because these pathologies, in terms of the loss of your cervical curve, have been shown to happen in crashes. And if that's not corrected, that has been shown to not just not get better, but it actually has been shown to break down. It's going to put abnormal pressure on your discs. That can change the blood flow of your spine, and that can lead to more chronicity. And then if we look further and we do what's called a digital motion x-ray, since you're having pain in your upper neck, we don't know if you have upper cervical instability or instability of what are called the facet joints, where one bone meets the other. So there's a lot of things that it sounds like you haven't had analyzed. And what I've always been told as a good provider is that if you can't rule it out, you have to rule it in. And no one, it sounds like, has really ruled out what your pain is. They're just putting you in as, I have whiplash. And whiplash is a mechanism of injury. Let's try to figure out what is actually happening and find out if there's a reason why you're still hurting a year after.
So I'm not crazy.
I mean, you might be crazy, but not because you're still hurting.
Two different things. Two different things. He does tell me whenever I go, he says, I'm out, I'm out. He says, I'm out, my leg is short, I'm out. And then he just
Your
keeps
leg is
adjusting.
short. Well, one, to find out if you have a true short leg, we want to x-ray your low back, which it sounds like they didn't do. And if you do have a true short leg, We want to look to see if you need a heel lift or if it's due to some kind of pelvic distortion, because if that's not fixed, then you're always going to be out. And if you're looking at your neck and your doc is telling you that your neck is out and they keep adjusting you for a year and that bone is still out, we need to find out what it actually means. Like, how far out is it, and what other structures around it may not be doing the job that it's supposed to hold that in.
Is there a way to do that?
Yeah, there's in terms of treatment or in
No, like what
diagnosis.
device? Is there like a software?
Well, to measure instability, meaning how does one bone move over the other, there is, and it's an accepted what's called digitization, where we take your images and we digitize it and we measure it. And there's established normals of what your neck is supposed to look like, both from the front and the side, and then how much movement is supposed to occur at each particular vertebra. And if you're outside the range, then we can say that there may be or may not be a problem. And then does that problem correlate to your symptoms? It's just like if we took your blood pressure. I can't tell you that your blood pressure is high unless there's an established normal. And when someone tells you that your bone is out, the only reason they can say that is because there's an established normal of what in is. And we need to look at your neck to see where you are.
Right. Why, I guess, I assume this is available to everyone. Why wouldn't my practitioner do what you're talking about?
Well, I mean, if you ask me personally and what I've seen, I think it has to do with laziness, and a lot of people don't like to be held accountable. I can't say that that's your particular provider, but
Right.
the information is there for us to understand if you're
Right. It's not like it's hidden. It's not like it's hidden. It's not like you're the only one that knows this.
No, this is the only way you can determine and tell you that your neck is stable or is unstable is to measure it. And that's the established guidelines. That's whether it's chiropractic, the American Medical Association. This is what is expected of us to be able to determine. And for me to say your neck is stable or unstable is by doing these x-rays or digital motion x-rays and then comparing it to the normal with measurements.
Will you be able to show this to my attorney?
Yeah, I'd rather show it to you so you understand it. And then,
yeah, no, I want to, but then I want to show my attorney, hey, there's potentially something wrong with me that hasn't been documented before.
Right. And that's the problem. It's not that you're having a problem and it's been ongoing for a year, and that can be very common after a trauma. So the question is, why are you still hurting? We can't just say you're out. We have to figure out, why are you out? What areas are damaged? And then what can we do to get that area healthier so that you can remain in and we can keep your body functioning at a higher rate?
Yeah, one minute left, gentlemen.
Okay.
Sorry. Okay. Dr. Katz, so you've seen this before? Like, you've seen conditions like this before, you've been able to help them?
Yeah, we see this all the time. In fact, we published one of the largest papers looking at normal necks and hurt necks after a crash with people with ongoing chronic pain. And we know that there's a very large difference in terms of stability and shape compared to injured population and the asymptomatic population. So we see this is what we do all day long.
Wow. Okay. Well, I'm excited to be here. Thank you for at least seeing me.
Yeah, I'm really glad that you are here. Now let's get to work. Let's gather your images. And if we don't have the right images, we're going to do it. We're going to look at it. And we're going to do a full competent exam to see what correlates and what doesn't. And then from there, we're going to give you the best treatment possible.
Thank you.
Yeah, you're welcome.
That's it, Doc.
I love it. This is exactly the kind of podcast that I want to be showing. Gentlemen, that was amazing. First with you, Curtis, giving context. What was that all about for you?
Say again, I'm sorry.
Give us some context what this.
Oh, I just know we experienced it too, but I know Dr. Katz does, in that he sees so many people from all over the country experience that on the regular, where they've been places for months, years, and never had proper diagnosis. And those questions they ask are just very common. Hey, why haven't this been before? I'm supposed to be better in a month. My attorney says I should be better in a month. My doc says I should be better, or it just, there's very little definitive objective measures that they use, and it is available to them. Like the stuff we're talking about, again, look at it. Dr. Katz even says he's published this. Like, that's why we publish stuff. We're like, look, we're not ordained and have, special hands. We're just clinically competent most of the time, I think, that we're able to measure stuff and do it.
I think also, Curtis and I call each other, or I call Curtis, and we bitch like, oh my God, this patient's been seeing these docs for a year and no one's even said or looked at this. And a lot of why we publish this or look at it is I want to know, right? They're great questions. Like, okay, like, the insurance company in a car crash, they have the right to say, well, how do you know this is an injury? And those are great questions. And a lot of these, like, okay, well, what is the difference between an asymptomatic neck and an injured neck? And like, that's a great question. So we looked and we did the largest biomechanical. We had like 200 patients or so. We had it blindly read with MD,
Amazing
PhDs,
paper.
radiologists.
Amazing.
And we're like, we don't know what it's going to show. And then we're like, oh, here's the numbers. We now know that these are abnormal findings in the, we found one that I think was like if someone had this pathology, it was 45 times more likely to be present in the chronic pain group than the asymptomatic population. So if you see that and they have pain, you're like, this is an injury. So
wow,
we just want to know, it's like we're just always trying to learn, like, well, what about this? Like, that's a good question.
Well, that's amazing work that both of you are doing. And then for the listener, just to give a little context, both chiropractors and MDs and DOs, they're under a lot of strain for a lot of different reasons, and they're also limited by what education and learnings they've had access to, and also the actual situation that they're in. And so in many ways, I would say that the hands of the doctors and chiropractors are kind of tied insofar what it is that they can do. You mentioned the word laziness, and sometimes it's also just that as well. But the reality is that can no longer be an excuse, because in today's world, we've got the science, we've got the technology, and we've got the ability to be able to serve at the highest level. And that's where we need to basically consult, with people like you, when we're not getting the answers. And we have to have the courage and the wherewithal to say, look, I don't know, but I'm not going to blame the patient for pretending that there is something that isn't there. But when the truth is, all kinds of injuries, they're very complex and they're just not structural. There's a lot more to it. And so to disregard that, and yeah, sure, there's people that abuse it for sure, but it's incumbent upon us to do all the right work. And I'm so impressed by the work that you're doing insofar as showing people the truth of what's really going on. So I want to give the mic back to both of you. What else is present in this context of what it is that you do, and what patients can actually do to help themselves?
Good question. I guess, well, there is a referral network. Like, we're part of a group, and Doc, you know this from Dr. Hasim, and he actually trained under Deed Harrison, is we do something called CBP, or chiropractic biophysics. There's actually a website, it's called idealspine.com. And so patients can actually go there and look up who's certified, advanced certified, instructor level. So because we're all over the country, all over the world. And even so, I know with Dr. Katz, if there's people fly over all the place to see him as well. Whenever someone is even out of state to see us, I always check to see if there's a colleague in the state to see, hey, you don't have to travel to see me. You can go see XYZ person. But I think that the population at large, even other practitioners, as they become more aware of this, need to, because there's specialties. Like, I have no problem. I say to patients in office all the time, hey, we don't do everything here, but we know where to send you most of the time. We send to the best surgeon, we send to the best nutritionist, we send to the best whatever specialty it is, best physical therapist. We feel that our referral sources are of the highest level. So I just think more practitioners should be realizing that they need to seek out that kind of like knowledge that we have. So at least we can help direct them to someone in their state.
I also, I know it's hard schedule wise, so I can't promise this, but I always have patients like, hey, just reach out and I can, try to send you somewhere. Like, sometimes we do consulting with Zoom. I don't do a ton of it just because, we have patients that we spend our time with, but like Curtis said, we're going to try to find where you are and who's around there with someone we know. Because I know how frustrating it is. Like, listen, being in the healthcare with, and again, you're Bart, you're a surgeon, like, we work with and we're super grateful that they're surgeons, right?
Right.
I do think, unfortunately, especially in our profession with spine surgeons, they get a lot of bad press, like, oh, fusions fail. And it's like, that's not the surgeon's fault. They're taking something so bad and they're trying to decompress something. And yeah, there's going to be some outcome, there may be some complications, and it's a real thing, but there's surgeons that I know that also like really look at the alignment and this, and they, and as conservative as possible. And we just try to get like, hey, there's a lot of patients. I'm like, well, this is way past what I can do here, but here's the next step. And then let's try that next step. And then here's another step that you may be able to try. And we're going to do it, but at least we can try to minimize the frustration of the patient where, it's consumer beware. Unfortunately, you can go to 50 different chiropractors' offices, 50 different surgeons, 50 different, and they're going to come out completely confused. And, sometimes they feel like they're shuffled in and shuffled out. So I just say like, hey, reach out to us. We'll try to do the best we can, and try to get you to, even if you're in Europe, we get stuff like that all the time. Hey, I'm in Europe. Who do you know? Like, oh, we do know people in Europe, and we just want to get the patients to the right place.
Well, once again, giving context to all of this, I mean, when you think about it, is that, you got a super highway of information going down your spine. And the truth of the matter is that it's connected to all parts of your body. And when there is a structural shift, whether it's severe or even just mild, it's going to change how your body's communicating. And, with the 70 trillion cells that we have and in our brain connecting with everything, when there is structural changes, it's going to affect everything. And so to think, even if there's no imaging that shows anything that's wrong, clearly, there's that possibility that things are definitely wrong. And so at the end of the day, as a listener or viewer, if you're feeling something, just assume that there is a problem and that there is a solution. And it's actually your responsibility to do the work to figure out who can actually help you. In today's world, there are many people like yourselves that can solve the problems. And so, once again, the work that you're doing, and then we need to enlighten, our other colleagues to understand that, yeah, we're not going to know everything. And we should be comfortable to say, look, we don't have the answer here. Let's not put up a smoke screen and say, look, somebody's malingering. Just be honest. We don't know what's going on, but I'm sure somebody does. And let me help you find someone. And I do that all the time with my patients. I mean, as a plastic surgeon, I don't do everything. There's certain things that I don't do. And I will help them figure out, okay, here's a person that I trust, go there. But what's remarkable, what I think that you guys have done, because the truth is that, when surgery was invented many, many years ago, it was so basic. And with all the advanced technologies and recognizing where surgery has failed, people like you have sought out different solutions, and quite frankly, they're better.
Well, so I'm curious. You said something where you're like, hey, there's a lot we don't know, and there was actually some really fascinating studies where they took dead bodies at the scene of crashes and they imaged them, and they did like CT, X-ray, and then they did cryomicrotomy where they froze them and sliced them. And there were tons of pathologies that we don't have the technology yet to pick up. Do you see that when you're doing surgery too? You're like, hey, we did CT, MR, and then when you got in there, you're like, whoa, like, we did not see this. Is that?
So I can't claim to say yes to that.
Okay.
My procedures are more reconstructive and or cosmetic, so
Okay.
I'm not necessarily seeing those things. And at that microscopic level, for sure. But I do believe that we have so much to learn. By the way, I mean, basically, you're alluding to the fact that there's so much that we don't know, and again, being complacent. Many of the docs out there have studied for years and years, and now they're battling an interesting, what I would call a hostile medical environment. So they don't have the time to really start investigating even further and learn more, basically the kinds of things that you guys have discovered. So, you're leading the way for the rest of us.
Well, I think if you're a provider and you're saying the exact same thing today that you did 10 years ago, you're falling behind. like you said, we don't, like what we're going to say, what we're going to be saying in 10 years of what we know is going to be different than what we know now. Like as
And
technology evolves, as research, as we start to, some of these docs are like, oh, I've been in practice 40 years. I do this the exact same way every time. And you're like, I don't think I want to be here.
well,
Curtis.
what we love too, Bart, is that at our seminars, we've had on more than one occasion where it's like, hey, I know we've done this in the past. Stop doing this at CBP because here's what we found.
Right.
Because it works out and it's so enlightening. It's actually so liberating on so many levels to understand why we've had failures in the past. And when they point out why, you're like, oh gosh, we can talk about pelvic morphology, meaning the shape of someone's pelvis versus someone else's, why we would get a correction and why we wouldn't, what parameters we have to change. And Evan and I'll talk about that when he goes role reversal. But I just know, even in my latest endeavor as far as doing this spondy work, as I call it, I've seen cases where like, oh, for sure this is going to respond this way. And then when we take the stress view, it doesn't at all. And I'm like, huh. And then I have to figure out why. But I'm lucky enough because I get to actually X-ray it and I keep moving stuff around until it actually goes in place. But the assumption doesn't always fit the mold, if you will.
And I would have to say this, and then the main narrative that I have, with the new approach to medicine, which includes, the addressing the structural part as part of everything else that needs to be addressed. But the other part, on a grander scale or a higher level, is three things. Number one is responsibility. Ultimately, we're all responsible, including the patient, to really understand, what's really going on. The other is the root cause. But the other final thing, and this is what really differentiates you guys and your approach, is data. And it's so important to have the data. And with your techniques, you're identifying, you're capturing that data to absolutely understand what it is that you're doing. And, when you don't do that, then that's a problem, because still it's a lot of guesswork. And so you can have, 10 people present with the same kind of problem, but they're all different. And so without the data, without the measurements, and just looking at an X-ray is not enough. The fact that you do very precise measurements and very precise techniques, that's really huge.
We're again always very humble, but always trying to do better.
I love that. Well, as we wrap it up, Curtis, please let us know how people find you and last words for you, and then we'll go with Evan.
We're at betterhealthbydesign.com. And like Evan as well, we do online consults and stuff like that for people. We do that 15-minute, half an hour intervals if they want, and that's pretty much it. Yeah, betterhealthbydesign.com.
Okay, and any final thoughts?
No, just again, thanks for the dialogue. I do have to tell you one quick thing. We have a guy flying in from New Mexico. He, as I say, a snooty Cambridge grad, MD, PhD. And he's coming for special care. And actually, he was responsible as we're fixing him. He says to me, thick accent, very thick accent. He goes, how are you keeping track of all these measurements you're doing? And at the time, as I say, it was stick and rudder, literally like a tape measure, for this table. So since that time, I actually have hired someone to make a digital laser device that keeps track of all of our movements. So it makes it easy for staff to put these people on. It's very reproducible. Let's put it that way. But it's just how people challenging us. We're always trying to get better. That's something I'm really proud of recently anyway.
Yeah, I love that. And I may have some ideas for you afterwards. Evan, how do people get a hold of you, and final thoughts?
Let's see, we're at Katz Chiropractic in Boulder, Colorado. If you're a provider, we also have a consulting with research called professionallyintegrated.com. And we're always here to help. Like if you're a patient and you're struggling, just reach out. We could try to find you someone and just help direct you. I love what I do, my wife as well. We just want patients to get better because we're patients ourselves. We rely on other people to keep us together, and rely on my wife. I just called Curtis before we got on the phone with something with my body. Like, hey man, it's hard to, so reach out. We sympathize and empathize with patients that are suffering and feeling like they're being run around. What Curtis was saying is oh, am I crazy? That's not, we're joking, but I feel bad for the patients that have been told that. And then when you give them an appropriate diagnosis, they cry because they finally know now how to get the appropriate treatment. So
Yeah, I see that a lot.
Yeah.
There's a lot of pain, there's a lot of fear in situations like this, and then especially when you don't get the answers. But with you guys, with this, your precise techniques and the data and the measurements that you're able to get, that's definitely a game changer. And I think more and more what we'll see in medicine and in wellness is the data, number one, to be able to measure, and then also to monitor. That will make a huge difference. Well, you guys are definitely pioneers. Really enjoyed the interplay. I think many people will get a lot of benefit from this, because then this will be clear to them that yes, there is hope and there's a pathway, and find out a CVP chiropractor. And critical part of our lives is the structure of our body. And what I learned from you last time, Curtis, is that essentially, we need to have an adjustment every single week for our bodies to, function properly.
Yeah.
So again, you guys do great work. Thank you both.
All right.
I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. Hopefully you got a little triggered here, because that means that you have some work to do, and whether structural or not, if you're feeling some pain in your structural part of the body, then, find out the right people that can help you, because you know what, you deserve it, and the rest of the world deserves you in a better state. Thank you, and we will be back.
Thank you.